The number of First Nations children in Australia with an ear or hearing problem has nearly halved since 2001. That's according to a new report from the Australian Institute of Health and Welfare being launched today, with early testing and early intervention leading to much improved lifelong outcomes. Warramai man, Professor Kelvin Kong is an ear, nose and throat surgeon from the University of Newcastle. He tells us what the stats are showing.
First time I'm able to give some good news in relation to some improvements in what we're seeing in ear disease rates. Certainly from a newborn hearing perspective, our catchment rate is very high, having higher 90s in the percentage of people who are being tested. And also we're seeing a slow decline in that long-term hearing problem rate that we're experiencing. What that doesn't pick up though is that doesn't pick up the significant rates of preventable ear disease that we're seeing. Still, otitis media remains one of the highest problems that we're dealing with, and it is a preventable hearing loss that we can actually deal with straight away.
I mean, each of these stats is a person. What does this early screening and intervention, these outcomes, what does that mean for those individuals?
Oh, the most important part is that we need to get onto this early. I've always said that hearing loss is a preventable but also an emergency that we need to look at from a developmental point of view. And so making sure, particularly those who have kids out there, the parents, that they know when their kid's not actually performing or not reaching their milestones in speech and language, we need to get on this quickly. We know from the research that the earlier we get onto this, the less the problem long term. But more importantly, the earlier we get onto this, the more do the children actually partake in this thing called life, where they're engaging in songlines, sing, laughter, dance, but also just that general language. We don't want to put them behind in school. Often in the past, we've waited till the school started, and that means we're falling way behind in terms of getting on top of this quickly.
And tell us a bit more about what was behind this improvement from 2001 to 2019.
I think it's a combination of a few things. Certainly awareness is one of the biggest things that we know, and the awareness is not much from the health side of things, but more from the community side of things. Parents are no longer tolerating this as a problem. Parents are worried about their speech and language development, so they're actually seeking help. And when they can't get the help, they're actually moving around to make sure that they find the help that they can get. And a big resource for that is a community-controlled health ARCHOs, which make a big difference in making sure that the community actually get the access they need. The problem we have is difficult access to primary healthcare services. We need to make sure we bolster those primary healthcare services, but also look at innovative ways. So it's not just an ENT that you see. It may be represented by an Indigenous health worker or an Indigenous health practitioner, an audiologist, a nurse audiometrist, a nurse, or just your general provider, which actually can help you understand and navigate this hard thing called the health bureaucracy.
Yeah. And how do First Nations people compare to non-Indigenous Australians when it comes to ear health and hearing?
Oh, fall well behind. Certainly in the remote communities, you're seeing some disease rates of up to 8-9 times greater, and in the urban communities, you're still seeing disease rates of 4 to 5 times higher. So although we're getting some improvements in this space, we're still a long way behind to make sure that we're closing the gap. So these kind of reports are so important to make sure we get the appropriate data to actually read the picture and read the landscape, so we can actually put concerted efforts to make sure this doesn't continue, particularly in Australia where we live in such a beautiful country.
Yeah, and I mean, a lot goes into this, as you say, but are screening rates equal now?
The screening rates are improving. And the hard thing with screening is that screening big populations can be quite difficult to make sure we get on top of. So I still come back to making sure that two things happen. Number one, that parental concerns are addressed when there's any concerns about speech and language. And the second thing is that every opportunity that we get as a health provider to look in kids' ears and test their hearing, we should do that. Doesn't matter who you are in health bureaucracy, even teachers in that aspect need to make sure that we know this is a high priority for us. If there's any concerns at all, get onto it. It's a very simple, easy test, which will actually help us get the kids on the right pathway.
And your report sets out measures to track changes over time. You're looking at hearing, but alongside the use of health services. What's the trend here?
There's an improvement in the use of health services. So we're finding that there's a better engagement in the MBS numbers for ear services, and that's kind of good from a hearing point of view. There's been a lot of work in making sure that hearing aids are fitted at an earlier age, and we've decreased that rate from the first fitting from an age of 7 to 9 down to 4 to 6, which is a huge improvement from that. We're seeing our kids getting cochlear implants, which is something we hadn't seen in the past, which is a wonderful advent for us, but also the engagement within the health society has actually improved where we're using the item numbers. I still think a lot of the interventions are predicated on your postcode rather than the access you need, and I think that's something that we need to strive harder to improve.